Hi, today we are discussing about drugs in cardiology. In cardiology, there are several disease conditions: myocardial infarctions, coronary artery disease, endocarditis, myocarditis, heart failure, etc. Whatever may be the disease condition, problems are associated with heart rate, heart muscle contraction, blood pressure, blood clotting, fluid buildup, cholesterol buildup, etc. So, the drugs in cardiology are also intended to cure these associated problems. Let's see what all are the medications. First, we can discuss about antihypertensives, the drugs which are reducing blood pressure. Under antihypertensives, there are four groups of drugs we are discussing: ACE inhibitors, beta blockers, calcium channel blockers, and diuretics. Let's see how this group of drugs helps in reduction of blood pressure. Let's discuss how ACE inhibitors helps in reduction of blood pressure. It acts by inhibiting renin-angiotensin-aldosterone system. Actually, renin-angiotensin-aldosterone system helps to increase blood pressure. Whenever there is a lower blood pressure occurs, our kidney will release renin and it activates this system. It will increase the blood pressure also. The details about this renin-angiotensin-aldosterone system we can discuss in another video. But as of now, just remember, when inhibiting this system, blood pressure get lowered. In a single step, what is happening in this system is angiotensin 1 get converted to angiotensin 2, which is a vasoconstrictor and which will helps in increasing blood pressure. By inhibiting this system, the end result is reduction of blood pressure. Okay. And in another way, how ACE inhibitors helps in reduction of blood pressure is it helps in vasodilation. When vasodilation occurs, BP get lowered, and vasoconstriction occurs, BP will increase. That you know. Okay. And it helps in reduction of aldosterone secretion, another way of reduction of blood pressure. What is the role of aldosterone and who is producing aldosterone? Aldosterone is produced from adrenal cortex. It helps in sodium and water retention and potassium excretion. As of now, just focus on sodium and water retention. When aldosterone lowered, water retention was also lowered and BP also lowered. That is the point. Okay, these three things are happening when we are taking ACE inhibitors to help in reducing blood pressure. Beta blockers. They are blocking beta adrenergic receptors. There are different types of beta receptors. Some are found in heart, lungs, blood vessels. These receptors get activated when there is an emergency, when fight or flight response. Sympathetic nerve system is get activated. In such situation, our body needs increased blood, oxygen, energy, everything. So, gluconeogenesis is happening, glycogenolysis is happening, heart rate increase, blood pressure increase, vasodilation occurs, bronchodilation occurs, everything is happening. But here, beta blockers, they are blocking all these activities. What is the result? BP, heart rate, everything is reduced. So, we are using beta blockers as antihypertensive. For example, metoprolol, atenolol, etc. Next is about calcium channel blockers. Calcium channel blockers helps in reducing BP by relaxing the blood vessels, and it will helps in reducing the workload of the heart also. For example, verapamil, amlodipine. Then diuretics as antihypertensive. By removing the excess fluid, it acts as antihypertensive. For example, furosemide, hydrochlorothiazide, etc. You need to study the classes of diuretics for your prometric examinations. That needs a separate class that we can discuss later, okay? So far we have covered antihypertensives. Next group of drug is antiarrhythmic drugs, the drugs which control rhythm. Under antiarrhythmic drugs, four classes of drugs are there: sodium channel blockers, beta blockers, potassium channel blockers, and calcium channel blockers. In this, calcium channel blockers and beta blockers we have already discussed under antihypertensive. Now in this group, how it facilitates in antiarrhythmic effect. Let's see. Let's talk about sodium channel blockers and calcium channel blockers together, because both these group of drugs acts on the depolarization state of the cardiac cycle. Normally what is happening in depolarization, the influx of the sodium ions and calcium ion occurs to excite the cardiac cells. To control arrhythmia, we need to prevent this excitation. So, we are using these blockers, blocking the entry of the sodium and calcium ions into the cardiomyocytes, thereby preventing the excitation. That's what we need to control arrhythmia. Okay. So, by giving sodium channel blockers like lidocaine and calcium channel blockers like verapamil, we can control the excitation of the cardiomyocytes and thereby controlling arrhythmia. Okay. And regarding beta blockers like propranolol, as I already said, it blocks the beta receptors, so it reduces the heart rate and force of contraction, and thereby we can control arrhythmia. Next is about potassium channel blockers like amiodarone. It acts on the repolarization state of the cardiac cycle. Normally during repolarization of the cardiac cycle, there is outflux of the potassium ion occurs to maintain more negative charge inside. Only by maintaining the more negative charge inside, the cells can go for repolarization and subsequently depolarization. Okay, that is the excitation. By preventing this outflow of the potassium ions, by giving potassium channel blockers, we are actually delaying the repolarization and thereby delaying the depolarization also. That's what we need. We need to delay the depolarization to control arrhythmia. By blocking the potassium ion, we are blocking or delaying the repolarization and eventually delaying depolarization. Okay. Next group in cardiology is anticoagulants and antiplatelets. Anticoagulant helps to prevent blood clots. For example, we can use anticoagulants to prevent blood clots in case of transplants, after vascular surgery, etc. Examples are heparin and warfarin. And antiplatelets works by preventing the platelet from clumping together to form the clot. For example, aspirin and clopidogrel. Next class of drug under cardiology is lipid lowering agents. For example, atorvastatin and rosuvastatin. By depositing this cholesterol inside the coronary arteries, it leads to coronary artery disease and thereby leads to myocardial infarctions. So, to prevent all these conditions, we can give these statins. Vasodilators can be used to improve the blood flow. For example, nitroglycerin and isosorbide. Nitroglycerin can be used in acute angina, and chronic angina we can use isosorbide. Let's see some emergency drugs. In bradycardia, we can use atropine because it increases the heart rate. It causes decreased secretions also. In cardiac arrest, epinephrine can be used because it helps in overall stimulation of myocardium. In anaphylactic shock, epinephrine can be used because it helps to increase the vascular resistance and helps to restore the BP. In anaphylactic shock, BP is dangerously lower. So to help to increase the BP by increasing vascular resistance, epinephrine can be used. And it relieves the bronchoconstriction and reduces swelling in case of anaphylactic shock. And further release of allergic mediators can be prevented by using epinephrine. And in acute heart failure, more fastly acting inotropic agents such as dopamines and dobutamins can be used because it helps to increase force of cardiac muscle contraction. That's all about today's section. If you have any doubt, please comment below.